evening, listeners. This is Sheeba Rakesh welcoming you to yet another edition of the English program. And today we have with us Devansh Sharma, a lawyer and educator by profession, who's going to be telling us about the various health schemes that every family in general should know about. Because health challenges come without warning, and at such times, correct information is our only and strongest support. So we're going to be talking about health schemes, Devansh. Welcoming you to the studios of Akashvani Lucknow.
Thank you so much, ma'am. It's a pleasure.
To begin with, which government health scheme, according to you, should families know about first?
One of the most important schemes today is Ayushman Bharat. PMJ Arogya Yojana or PMJ. It provides financial protection for hospital treatment through a large network of impaneled hospitals across the country, including many in Uttar Pradesh. Earlier, coverage focused on economically vulnerable families identified under national databases. However, a significant expansion now ensures that every Indian aged 70 years or above is independently eligible regardless of income. Once a senior citizen qualifies, their spouse, if part of the same household and recorded as one family unit, is also covered, even if the spouse is below 70 years of age. Also, the siblings, if they are also a part of the same family unit, they shall also be covered. Eligibility can be checked by calling 14555 or visiting the official PMJ portal, where e-cards can be generated with basic verification.
Now, talking about eligibility, Devansh, we have families who may have severe health problems going on, but they are not covered under national databases. What about them?
I understand this problem. In Uttar Pradesh, this can be addressed through Mukhyamantri Jan Arogya Yojana, commonly known as CMJ. The scheme extends health coverage to families who may not be included under PMJ, such as certain ration card holders and middle income household. Together, PMJ and CMJ ensure that a large section of Uttar Pradesh population has access to hospital care without financial strain. Citizens can apply or check details through the official state health scheme portal.
That means if you're not eligible for a national level health scheme, maybe you should go in for a more state specific scheme. Am I right?
That's right, ma'am.
Does that mean that state schemes are often more generous than central schemes but less publicized?
Yes, each state designs health schemes based on local population needs, disease patterns, and budget priorities. For example, some states cover treatments not covered by central schemes.
That's interesting.
Yes, and some include OPD benefits. Some provide medicine reimbursement. And the rare point, a person may be ineligible under a central scheme but fully eligible under a state scheme, and we never check that.
So, listeners, as our expert just told us, sometimes it happens that we may not be eligible or we may not find ourselves eligible for a national health scheme. But when we check ourselves for our particular state, we might very well be eligible and might stand to receive various benefits from the government. And this is especially reassuring for senior citizens and their families. Now, talking about government employees, Devansh, can you tell us more about how eligible are the government employees for such benefits, and are there any differences or are there any specific methods through which they need to apply for such health schemes?
Definitely. For central government employees and pensioners, the Central Government Health Scheme or CGHS provides comprehensive medical care, including outpatient services, hospitalization, diagnostics, and medicines through CGHS wellness centers across the country. Coverage extends to the employee or pensioner, their spouse, children up to the age of 25 years, and dependent parents. Similarly, Uttar Pradesh state employees are covered under the Pandit Deen Dayal Upadhyay Rajya Karamchari Yojana, which offers cashless treatment at designated hospitals.
What about healthcare support for women and children?
Well, there's several schemes focused specifically on maternal and child health. The Janani Suraksha Yojana encourages institutional deliveries by providing financial assistance to pregnant women, especially in rural and underserved areas. The Pradhan Mantri Matra Vandana Yojana offers maternity support for the first child, helping families during a crucial phase. For children, the Rashtriya Bal Swasthya Karyakram provides free health screening from birth up to the age of 18 years, covering early detection of health conditions and developmental concerns. Even in Uttar Pradesh, additional assistance is available through state-level maternal and child welfare schemes.
Can you please tell our listeners, Devansh, how can families practically use these schemes? Because sometimes it so happens that a lot of us know about so many schemes which are available through government websites, but not many of us know how to access these schemes.
I understand this doubt. The process is straightforward. Families can verify eligibility online or at designated help desk. Visit an impaneled hospital in your city, complete verification and receive treatment without upfront payment. For many households, this support prevents medical expenses from becoming long-term financial stress. These schemes function as public health protection, ensuring timely care when it is needed most.
So listeners, what is important to remember here is that these schemes are completely gender neutral, and let me tell you, they are also caste neutral. The eligibility may vary depending on the scheme, and it may be based on the age, the household records, the state residency, or being a government employee or otherwise. In general, the grievance mechanisms exist to correct exclusions due to outdated records. So in case you're facing any problems, I would strongly recommend that you get in touch with the medical practitioner in your city who has the knowledge about the specific scheme you are looking forward to being treated under, and then get yourself all the benefits thereof. When we are talking about the government health schemes that families should know about, it is mandatory that there have to be certain documents a family should keep ready with them so that they can actually benefit from these schemes. What are those documents? Kindly let our listeners know.
See, this is extremely practical and rarely discussed. Every family should keep Aadhaar cards with them, ration card or income certificate, residence proof, your mobile phone which is linked to your Aadhaar, and basic medical record. Every person should have their Aadhaar ID ready so that you can access all the medical information present at the center database.
What is ABHA?
ABHA stands for Ayushman Bharat Health Account. It is a unique digital health ID created under the Ayushman Bharat Digital Mission (ABDM). In simple terms, ABHA is like a bank account for your medical record, but fully digital and consent-based.
I must ask you something very important. When we are speaking about health insurance has become a fad. Health insurance is also a necessity these days because we see very many companies or very many providers coming up with lucrative schemes for people looking forward to attracting them as potential investors or clients when it comes to health insurance. Can people combine private health insurance with government schemes?
Yes, they can. It is a very smart planning. Government scheme can act as a primary coverage. They can reduce out-of-pocket expenses and be supplemented by private insurance for higher rooms or uncovered procedures. People assume it's either or. In reality, is both and.
So that is a very important thing that Devansh has told us, listeners. And Devansh, what is the biggest mistake families make regarding government health schemes?
One word: waiting. Waiting for a medical emergency, waiting for that hospital visit, waiting for someone else to explain things. By then, stress blocks understanding. The rare truth is, awareness before illness is worth more than money after illness.
And if you had to give just 3 actionable steps to every family, what would they be?
First step, check eligibility once a year. Second, know the nearest impaneled hospital. And third, talk about healthcare at home before it becomes urgent. These 3 steps alone can save money, time, and emotional trauma.
A very contentious question. Sometimes it so happens that hospitals refuse patients even under government schemes. Is that legal?
This is where legal awareness becomes crucial. If a hospital is impaneled under a government scheme, it cannot arbitrarily refuse treatment covered under that scheme. What many people don't know, hospitals sometimes push patients toward paid treatment. They may say beds are not available while beds actually are. Or they may say this procedure is not covered without explaining alternative. Knowing that refusal can be questioned politely but firmly changes the entire power dynamics. You can also reach out to the government through social media or at the provided portal where you can register your complaint.
Can you tell us something about Ayushman Bharat that people usually don't know?
Yes, and this surprises almost everyone. Under Ayushman Bharat, treatment is cashless, and the coverage can go up to 5 lakh per family per year. There is no cap on age, and pre-existing diseases are covered from day one. But here's the rare part. Even if a family doesn't have an Ayushman card, many hospitals can still verify eligibility digitally on the spot. People assume we don't have the card, so we're not eligible. That assumption alone has cost families lakhs of rupees unnecessarily.
Many people assume that these schemes are only for the very poor. Is that actually true?
This is one of the biggest myths. Government health schemes are not just income based, they are also age based, gender based, occupation based, and state residence based, and sometimes event based, like pregnancy, disability, and serious illnesses. So a family may be ineligible for one scheme but fully eligible for another.
And might not just know it.
Yeah, and might not just know it.
Then let me ask you, why do people still not know about government health schemes even today?
Because awareness about health schemes in India is largely reactive, not preventive. Many families hear about these schemes only after a hospital bill arrives, when stress, fear, and urgency take over. What's more surprising is this: many government health schemes are designed to be a silent helper, not aggressively advertised. So unless someone actively checks eligibility, the information stays hidden even though it exists for them.
So there lies the important part. So the idea is to become proactive. We don't have to wait for the disease to knock at our doorsteps to be able to reach out to these government schemes. Instead, we must take the first step and find out whether we are eligible for these schemes. And it might save our families a lot of risks, a lot of seriousness, a lot of loss of money, and a lot of undue stress. You joined us in the studios of Akashvani Lucknow and informed our listeners about so many important health schemes and informed our listeners about so many government health schemes about which every family should basically know. We stay thankful to you.
Thank you so much, ma'am, for calling me over.
With this, we come to the end of this edition of the English program, and we had with us lawyer and educator Devansh Sharma, who was telling us about the important government health schemes which every family should know. I hope, listeners, that this edition of the English program gave you some very important knowledge which you will stand to benefit from. With this, Sheeba Rakesh signs off. Namaskar.